Okay, good morning, everyone. Thank you for attending this morning's open research office session. Today's topic is common mishaps of community engagement and recruitment. And our two speakers are Grace McKenzie, our CTSI community engagement specialist, and Ashley Regling, our CTSI clinical recruitment coordinator. If you guys have any questions, you can feel free to either put your hand up in Zoom or you can leave a comment in the chat and I'll read it out to them. At the end of this session, there will be a survey and it will pop up after you close out the Zoom browser. I'm asking that you please stay and take the survey. It is a total of 6 questions. It should take you 5 minutes, but it's really important for funding and making sure that we can keep these ORO sessions going. With that being said, Grace and Ashley, you guys can take it away.
Okay. So I'll advance to the next screen.
Yes. So just to start with a few housekeeping items, we're just going to go through a few brief introductions, then I'll turn it over to Grace, who will discuss common mishaps of community engagement. Then I will discuss some common mishaps of recruitment. And then at the end, we'll share our contact information, as well as, like Marshall said, questions throughout are welcome, but also at the end, we can accommodate those as well. Next slide, please.
Sure.
So Grace and I have the pleasure of being part of the community and stakeholder engagement core within the CTSI at UB. So really we cover a lot of different services, typically focused on helping research teams and PIs either during the grant preparation phase or during study startup, during the active recruitment phase, as well as at the end once the study has closed, helping to disseminate those results. So we like to say we wear a bunch of different hats. We typically never know what the day is going to look like, or if we think we do, it tends to change regularly. So with that being said, I will turn it over to Grace, who will talk about some common mishaps with community engagement.
Thank you, Ashley. So community engagement is the process of working collaboratively with and through a group of people. So for community engagement, it really is a continuum of engagement where you can have engagement as simple as being an educational piece that is informing the community that you're researching about what your research is. It can start out as simple as that, and it can go as in-depth as being community-based participatory research, where you have the community involved in every aspect of your research, from developing the protocol to all the study implementation and methodology and publishing of findings. So really, there's a broad sense of community engagement. Today, I'm going to talk more about tips for community engagement rather than mishaps, because I find working with the positive is kind of my thing, which is good ways to promote your research in the community rather than mishaps. Now, plain language works hand in glove with community engagement. So plain language is common language that is used to reach the average person in a community. So it's really important to use common language or plain language when you're trying to do community engagement. A lot of the tips that I'm going to talk about in just a minute have come from a community project that we're doing right now. It's a plain language project where we are interviewing representatives of different communities that work at community-based organizations, grassroots organizations, or coalitions in the community. So these are folks that are community contacts of ours that are social workers, community engagement specialists, boots on the ground people that want to share their perspectives of working in various communities in Western New York. Our goal is to interview 50 people representing all 8 counties of Western New York. So far, we have 31 interviews compiled, and we're working to have our recruitment of the interviews finished by the end of March. This is important because our overall goal is to create a guide to working with communities with community engagement in mind and plain language in mind as a toolkit to augment your efforts as researchers on our website. So we're going to have a plain language guide that really showcases the nuances of how to effectively work with communities in our area. So with that being said, I'll move on to some of the tips. So really, participants want to be thought of as partners, not just a one and done, thank you for your information and goodbye. They really are invested. They want to be respected and not talked down to. So there is that sweet spot of being able to talk to the common person without making your language or your tone inaccessible or too technical. So it is an opportunity for education where you meet the person that you're speaking to at their level, and then that's a great opportunity to be able to introduce your research, introduce your study, and to be able to educate them on what you're doing in a plain language, respectful way that they will really engage with you on a deeper level. They're making language really common, using common words is really, really important. It really shows people that you respect them and that you're willing to work with them, again, as a partner, not just as a subject, but as a partner within your study. People like to feel like they are supporting a cause. So if you think of the Ride for Roswell that we have, where everyone really comes together on a day in the community to support ending cancer. You can see in the community that so many people are emotionally vested in this event because they're working for a cause. Let's end cancer. So really on a smaller level, you're really looking to do something like that where people feel like you're pulling on their heartstrings, like they are invested in your research and know that they are making a difference by participating. And that's really key, that people know that the work cannot be done without them because they are a valued person in your research, in your study, and in the community. And so people really like to think that their participation is moving towards a larger goal. So always focus on what your thesis is, what your larger goal is, what the community is doing to help you reach that goal. And there are words in common language that really seem very simple, but it's really powerful words to use. Words like help, learn, join us, or end cancer, end diabetes, end MS, or whatever you're working on. Because that shows people, yes, I can believe in this cause. Engagement is more than just one contact. Like I said, the one and done just doesn't cut it. It's not anything that people want to sign on to. They want to know that there's a bigger cause. So participation can begin at recruitment, but we do suggest that participation begin before the study is even written. So we do offer a community engagement studio where we can get together 8 to 10 people from the community you're researching and do a roundtable discussion on your study topic, on your thesis, and really get community feedback and buy-in from the very beginning, from the very seeds of your work. So that's something that, you know, we offer as a free service. And it really helps formulate the study from the very beginning. If you don't have community involvement in the very beginning, that's okay, because during recruitment, there's a whole lot of opportunity during recruitment to work with community engagement. So really, people who participate in your research want to be connected. So send a thank you letter. When you're done with your recruitment phase, you know, send acknowledgement to the people who participated, knowing that they made a difference. Have a results party. Once you have results, put them together in a flyer or in a letter with letterhead where you can thank them, but also show them that, you know, this is the results of your participation. This is results of our work together. And that's really a powerful tool. Believe it or not, snail mail still works. If you have results or findings that you are presenting as a deliverable, such as a poster presentation at a conference, a lecture series, a publication, share that with your participants. They love receiving mail that shows that they accomplished something. So they're interested in reading your articles. They're interested in knowing how you're furthering your research. So that's a very powerful tool, even though it's something that you think might be archaic. It's something that people really do appreciate. Any form of acknowledgement people really appreciate. Again, it's that feeling that you're emotionally connected. It's a feeling that you're making a difference. So think not just of what participants can do for your study, but make it bi-directional. So be a part of the community that you're studying. Go to community events. Meet with a community organization that works very diligently in the community, and forge a partnership with that community-based organization or that coalition. Go to those community meetings, those community town hall meetings. Show the community that you're visible in the community and that you're vested in the community to work together with them. That's very powerful. We have a community partnership development seed grant. So that is a grant that is $5,000, and we offer 2 grants a year where researchers can partner with a community-based organization or coalition in the community and really build a trusting relationship to forward community engagement, to forward your research in the community, to help resolve health disparities as the overall goal. So we do offer that once a year, 2 grants per year. And again, the hallmark of community engagement really is clear, concise, transparent, and authentic communication, making it so that you can build trust with the community that you're researching, because the trust is key. People will open up to you once that trust is seen within the community. I can stop now. Are there any questions? Okay, so Ashley.
Grace, Sandra,
Yes.
were you raising your hand?
Yes.
Okay, go ahead.
Hi. So, with the community engagement, now,
we will be, so how will we be connected? Because this is very interesting, and actually I think it's wonderful. Everybody should see this that's in nonprofit world, not just for a cause, but for engaging in our creation of our programs and developments by getting the community involved.
Yes.
So do we have to, how would we become part of this? How do we like come in and utilize these services?
To utilize our services in community engagement, just a simple initial contact with an email or a phone call that we'll give you at the end of the session. We
Okay.
have an initial consultation, so it would be about a 30-minute meeting to really get to know your research and your study and be able to connect you with those community-based organizations. So we would do a warm handoff in the community to initially have introductions between you and that prospective partner. We also, as the CTSI, we do events in the community all the time. We're at health fairs, we're at community events. So we would certainly keep you apprised of what's going on in the community and events and things that you can participate in. So we can start very simply with a consultation and develop a plan with you as to what's comfortable for you to get more involved and engaged.
Okay, now are you also doing Niagara County, all the other counties, and okay.
We do the 8 counties of Western New York. So yes, and in our plain language project, we have interviewed people from 4 of the 8 counties, plus the 2 major cities, so Buffalo, Niagara Falls. So we can certainly connect you in the Niagara Falls area. Absolutely.
Okay, thank you.
Thank you.
Okay, Grace, I don't see any other hands up. So I think we're
Okay.
good.
Okay.
Perfect. So I will take over and discuss some common mishaps of recruitment. So the first area we wanted to cover is study design mishaps. And a lot of times these are occurring before a study is ready to recruit. So typically during the grant planning phase, typically out of the hands of a research staff, but thought worth mentioning anyways. So we always want to try to avoid the inclusion of tedious and repetitive surveys. So sometimes as researchers, I think we're concerned with getting as much data as possible out of a study. And sometimes that can be really great, but other times it can have the opposite effect. You know, you can burn out your participants. They can become less engaged, not want to complete surveys if they've already completed them in the past, or just don't see kind of, you know, the overall goal for your study. So if you are going to be using, you know, a bunch of different surveys, really thinking, you know, what is the goal with collecting that data, as well as how can we sell it to the participants? So what is this really going to give us? How is it going to benefit society? That sort of thing. We also want to only require multiple in-person visits if necessary. This kind of has become huge post-COVID. I think we've all gotten really comfortable, obviously with Zoom or even the phone. So sometimes, you know, if you're doing a study that is going to be taking, you know, blood work or vital signs, you obviously can't do that via Zoom. But for other studies, you know, if there is a way to move at least some of the study visits online, that can help to alleviate, you know, any travel concerns that a participant might have. Next, we want to try to select a study site that is easily accessible by either the car or public transportation. Again, this might be out of the control of a study staff or even a PI, but really thinking about where your study is going to be housed. So for example, I always say that our UB South campus is a great location because it's central, it's located right on the major bus routes. There's ample parking, whereas, for example, Grace and I, our offices are on the downtown campus. So parking can be a big issue down here. People get stressed about, you know, either paying for parking or even finding a spot to park. So ahead of time, you can kind of prepare for that. The last bullet point is budget for travel cost reimbursement. So if you're able to pay for a participant's bus pass, down here if you're able to pay for their metered parking, or we have a bunch of different parking garages down here, building that into the study to alleviate that cost for a participant. And then also when I was a research assistant, I always tended to provide my participants with a map of, where the building is located as well as where to park. I think because I tend to be a bit nervous about those types of things, that it helped to kind of alleviate those concerns. And then lastly for this, budget for a participation incentive that is adequate as well as wanted by your population of interest. So really taking a look at what you're going to be requiring of your participants to do and making sure that we're really thanking them for their participation. So for example, if you have a study that is requiring a visit that is hours long and involving a lot of different components, we wouldn't want to pay someone, just $10 for that visit. We want to really make sure that we're, taking a holistic approach to it and building that in from the beginning. Likewise, with studies that might involve, for example, parents and kids, we wouldn't want to just provide an incentive for the parent. We also want to make sure we're building in something for the child or teen that is age appropriate for them as well. Grace, do you have anything to add to this area?
No, that's great.
Okay, next slide, please. So
Okay.
next is study material mishaps. So the first one is something that I think Grace and I see quite often. We want to always state the study goals and the relevance of the research. So typically this tends to be left off of study flyers, informational cards, most likely because, the research staff that tends to develop these materials, they're so into the study and so into that area that it kind of becomes second nature to them. But we really want to make sure it's obvious to our participants why this research is important, why it's being done, and what it's going to be used for in the future. And going along with that, we want to include both the immediate and the long-term benefits of participation, and kind of thinking outside of the box. So not just whatever the incentive is, but for example, if it's a study involving an MRI scan, that someone might get their results immediately of the scan, or might have for the long term, the results of the scan as a baseline moving forward. So again, kind of getting creative and thinking about what those benefits might be to your participants. Next, we want to always showcase that it is a study affiliated with the University of Buffalo. Doing so can really increase trust by the community that this study is from a reputable site. In my own personal Facebook, I tend to get a lot of ads from different studies, probably because I'm always Googling different research things. But I tend to put more value towards studies that, for example, might come from Case or Hopkins or WashU, because I see typically their lockup or something, and I assume that this study is okay, it's not a scam, and it's been vetted by an IRB. Whereas, sometimes I get other publicity that it's not clear who is endorsing it, and I tend to just kind of move along from that. And then we always want to make sure our materials are consistent with our UBA branding initiative, as well as include your affiliation's lockup. So you can see at the top of the screen, we have our CTSI lockup that not only denotes that this presentation has been developed by staff related to the CTSI, but also that we're affiliated with UB as well. And then finally, we always want to use images that are representative of your intended audience. I smile because Grace will catch me a lot on this, that I think I've, got the perfect image, and a lot of times she'll say, I think we can do a little better, or we might want to, use this image instead. So that's why it's always great to have a second set of eyes looking at your materials. A few other things I didn't include on here, going along with what Grace was saying with plain language, we want to always strive for a 5th grade reading level, as well as at least 12-point font. So I have my notes printed off from the slideshow, and I would say that the font on here is probably reduced to maybe an 8 or a 9. And I definitely need reading glasses, so I can't actually see the text. I can see my own notes, But if this was, on a flyer and it, anything less than 12 point, personally, I probably wouldn't be able to see it unless I have it way up here. So we don't want to make that, an added barrier that someone really just can't read the flyers. So making sure that, the font size is appropriate. We always want to avoid the term subject, which unfortunately, Grace and I, we still see this kind of regularly. We never want to equate someone with a condition or say that they're suffering from something. Instead, we want to say someone, living with depression, or, I have a friend that has cancer and she always says that she's thriving with cancer. So really making sure that we're trying to use, as Grace said before, kind of like that positive language as much as we can. And then if you're going to use an acronym, please describe it. This happens a lot to us too. We'll see acronyms on flyers and really not even know what they're meaning. So we always try to either avoid the use of acronyms, or if you are going to say them, make sure that we describe what they are. Next slide.
Okay, and just one quick thing to add, we do have templates. So if you would like to work with us to develop your flyer or your material, we're happy to share templates with you. And also, Ashley is amazing with Canva, and she does an awesome job with Canva. So to have a fresh template that is really designed really well, we can really help you with that.
Thank you. Okay, so next we'll talk about outreach mishaps, which I'll kind of go through what's on here and then have Grace add in her expertise. So for flyers, a lot of times I think people think that flyers are no longer effective, but sometimes I think that's just because we're not hanging them up in places that maybe could be effective. So I'm thinking about community centers that people still go to regularly. So Boys and Girls Clubs, the Ys, senior centers, libraries typically are frequented by, everyone across the generations. Supermarkets, if they're willing to. Laundromats are often forgotten, but as someone that did used to live in New York City and didn't always have access to my own washer and dryer, I spent quite a bit of time at laundromats, and it gets very boring doing that. So I definitely would have read bulletin boards had there been information provided there. Religious centers or employment centers, as well as clinics and hospitals, can also be great places to hang up flyers. But we always want to remind our study staff to remove those materials once your recruitment is completed. Both because, you don't want to have something out there that's no longer active, and you wouldn't want someone outreaching your study and then, unfortunately having it be closed. For mailing, as Grace said, snail mail can still be a great option. So if you're going to use that, you always want to budget for the use of a return stamped envelope. We never want to place the burden on a participant to use their own funds to return something to your study. As well as other people have found that using colorful text can really engage a person when they open the mail, as well as the use of a letterhead and signature, again, to kind of denote where the study is coming from and to showcase that it's from a reputable site. A personal contact can help people commit to research, which I know Grace will have something to say on this, but just thinking about my time as a research assistant, normally if I could get someone on the phone, I always felt like I had a better connection with them. Not sure if it, in the long run, if it helped with retention or not, but even just if you have both a phone number and an email address, giving the phone number a try first, even if you're just leaving a message and saying, I'm from UB, I'm from this study, I would love to provide a little bit of information. Please call me back at your early convenience. And really having them talking with you can help to alleviate their anxieties as well that they might have about participating in a study. We want to always have co-investigators share information, which I think is also sometimes forgotten. So co-Is can be, part of different departments or even different schools that can really get the word out. And then I know Grace will have something to say on this, attending health fairs and other community events as appropriate.
Yes, and attending health fairs is really connected with the personal contact as well. People like, especially post-COVID, people like in-person interaction. They want to see a face to your study. They want to see a face to your research. So connecting with one person individually goes a really long way. So whether that's, at a table at a health fair where you have a representative from your team there that can talk with people, or again, that personal phone call or that personal email really goes a long way. People really want to know who and what they're supporting.
Okay. And then lastly, we'll talk about some research team mishaps. We want to always ensure that our staff is properly trained on how to communicate with your participants, as well as how to convey respect. So I always suggest that, you do the role plays both before recruitment starts, as well as throughout your active recruitment period. So making sure that staff is comfortable with your phone scripts or with any scripts that you would be using at study visits. Making sure that people don't get, sometimes it's easy to get relaxed with what you're supposed to be saying and what's IRB approved. So just doing those regular check-ins with the staff to make sure we're all still kind of on the up and up with what we're supposed to be conveying. We want to set lab hours that are realistic and attainable by your population. And really conveying to staff before you hire them that there might be hours that they'll have to work that are outside of what is considered normal business hours. Personally, I've not participated in studies in the past because they've only been recruiting or, having the in-person visits Monday through Friday during, the hours of 9 to 5. And as someone that, is both a full-time employee as well as a mom, that just doesn't work for me. So, for me, having a Saturday option, I would definitely always be there. But again, making sure that when your staff is hired, that they know that, some Saturdays, some evening hours, maybe even Sundays might be required, but that you'll be flexible with the time on those other days. And then we always want to respond to calls or emails within a timely fashion. Generally, we say within 1 to 2 business days. Sometimes that might not be realistic if you have, a large amount of interest and longer screening procedures. So normally we suggest that you can touch base with the interested volunteers and set up a time in the future to do that longer screening, just so that they know that you've received their information and that you want to talk to them and that it's going to happen in the future. And then just a few other things that aren't on here. During that training phase, we also want to be aware of difficult questions that a participant might have and preparing your staff for answering those. And then I have a background in counseling, so I think I'm always concerned with emotions and mental health and well-being. So making sure to check in with each other, especially if recruitment isn't going as great as you had hoped. So making sure that staff is being, praised for what is going well, and talking about as a team what might be the barriers to participation or what might not be going well, and kind of understanding that we're recruiting human beings. So, everyone has such a large amount of stuff going on in their lives that sometimes you might be doing everything right as a study, and it might just be a bad time of year, or the emails might just be going to their spam folder, or something else might be going on. So Grace and I are always happy to meet with studies, especially during those difficult times, to try to think outside of the box and have a creative approach to solving those issues that might be happening for a study. Grace, do you have anything to add to that?
No, I don't think so.
Okay, I think that's all for me then. We wanted to share just a few resources that we have. So we have our recruitment resources toolkit that goes over a bunch of different things that might be helpful for recruitment. The templates that Grace had mentioned are in there, as well as information on plain language, a few different types of recruitment tools that we have. As well as if you want to meet with us, Grace will have our contact information on the next slide. But we also wanted to mention that we have a CTSI service request that covers all of our cores. So maybe you're looking for, not necessarily recruitment assistance, but statistical assistance or team science or something. You can submit a request through the portal for any of our cores that way. And then does anyone have any questions or any expertise that they would like to share as well for us?
Not seeing anything. No comments in the chat.
Okay. Well, just one thought about recruitment. You may want to think outside of the box if you're running into not, making full participation for your study. So, maybe that's tabling at a local business. For example, we've worked with a children's eating study that partnered with Anderson's because families eat at Anderson's. So they had information tables right there in the restaurants. So, you can think up outside the box for community partners and different areas to reach people in the community that you're researching.
Someone is asking, will the slides be sent out? Ashley or Grace, if you guys want to send it to me, I can turn them into a PDF and then I'll send them out with the email.
Sounds good.
I can do that, sure.
Someone left a comment and said, we believe generational communication preferences should be considered. For example, 30-somethings don't answer the phone. They would rather text. So sometimes that's important to note when doing community engagement.
Definitely.
Yes, thank you.
And then something I know that we all talked about when we were organizing this was from the clinical research facilitator point of view, when we're doing pre-reviews and we make a comment saying that, the consent form is at a certain reading grade level, you sometimes get pushback from researchers, but that's important because you're going into the community. And even though you're going to be verbally going over the consent form with them, typically, it's important for you to still try to achieve a good reading level, because what's the point of you speaking to someone, if they want to take it home and think it over and they get home and then they don't understand what you have on the consent form. It's not something that should be easily glazed over. You should sit and actually try to make it readable. Someone also said, thank you both. We are doing the majority of everything you talked about here at Washington University, but it's always good reinforcement. So if we don't have any other questions or comments, Ashley and Grace, thank you for your presentation this morning. And as I said, as soon as you guys close out, you will get that survey. Please make sure you complete it. It's only about 6 questions. And other than that, this recording will be posted on our website and our YouTube at a later date. So thank you and hope you guys have a great day.
Thank you.
Thank you.